And as cases across the country reach an all-time high, the toll on mental health is building. Mental health professionals saying COVID fatigue is something that should not be ignored. It can lead to poor sleep, low energy, irritability, difficulty engaging with others. A survey from the American Psychological Association found that nearly a third of psychologists say they are seeing more patients overall since the start of the pandemic. Of the psychologists who treat anxiety disorders, nearly 74% reported an increase in demand for such treatment, and 60% of those who treat depressive disorders saw an increase. Here to talk about the heavy burden so many are carrying is psychiatrist Dr. Sue Varma. Thank you so much for joining us tonight, doctor.
My pleasure. Thank you for having me.
So what kinds of mental health issues are you seeing right now, and how is it different than it was before the pandemic?
You know, for the last few months, people were really seeing a light at the end of the tunnel, and in many parts of the country, life had resolved and resumed back to normal. And for a lot of people, this newest variant has put a dent again back into their plans, whether it be for travel or gathering with family after 2 years of isolation. So this anxiety and depression really is layering on top of people being sick, people having remote learning for kids, people having lost jobs, people who are working right now having additional responsibilities because coworkers are out. So really, we're now seeing people more at risk also for post-traumatic stress disorder the longer the quarantine and the isolation requirements continue.
And what are the warning signs everyone should be looking out for, the symptoms of depression and anxiety?
So symptoms of anxiety and depression can be physical, they can be psychological, they can take form of in disturbed sleep. So you have people who have decreased lack of pleasure or low mood for 2 weeks or more. In addition, they may have loss of interest in things that were once pleasurable. So that's kind of sad to see that things that you were once engaged in, hobbies have gone down. You might have a feeling of worthlessness, of guilt, ruminations, thoughts about the past, and even sometimes preoccupation about death. I'm seeing increased anxiety and depression in younger folks. We know that there is a mental health crisis going on amongst younger people. In the beginning of 2021, we saw a 50% increase in emergency room visits in teenage girls. So we really are having problems really across the board, but especially in younger folks right now.
Yeah, we know that the pressure on teens is immense right now. How does the stress of the individual impact the family, and how can families stay healthy together?
Absolutely, and such a great question, because we don't realize that we live in a family unit or as part of a community, and really the mental health comes down to the basic unit of society, whatever that might be. And in some cases, it's often families. We see that pressure in the parents often comes out on the children. Children might be feeling more needy, more clingy, reverting back to any milestone that they might have achieved. So they might have difficulty sleeping. Some of them might have stomach aches or headaches. We see this in adults often as well, that somatic symptoms become predominant. And the stress on the family, whether it be financial, whether it be loss of life, loss of health, really every member of the family needs to be getting support and needs timeouts, if you will, but in a good way, I mean. And that might mean saying, I need a break right now. I want to go into a separate room. You know, a lot of times COVID has brought family members together in some ways, and they're spending a lot of time. That could be a good thing if there was already a strong foundation. But if there wasn't, that too much togetherness for a lot of people has caused cracks in the foundation that might have already been there. So recognizing that for parents, it's so crucial that they take care of their mental health. And there's so many support resources available. Sometimes we're not even using them. Jobs are offering things like BetterHelp or Talkspace as part of employee resources. There might be access to Calm or Headspace, these apps that people can use for mindfulness. But there are 4 things that I say that if you can do 10 minutes each, it will go such a long way. I call them the 4 M's of mental health, and they can be done as a family. So movement, mindfulness, meaningful engagement, and mastery. And mastery is just something that's pleasurable, that might be a little bit challenging, but see if you can take care of your mental health in these 4 basic ways every day.
And there's so much pressure because you're also trying to make sure that your kids' mental health is okay, and especially if they're not open about it or talking to you. What if you don't have family? What if you live alone, you don't have family nearby, you've been feeling isolated, your social interaction is limited or cut off because of COVID?
Yes, so it's really interesting because a lot of times we always tell people to use the National Suicide Prevention Hotline. Well, there's some things called warm lines where you can actually pick up the phone and talk to somebody to say, I'm not thinking about suicide, but I really just want to talk and want to connect with somebody, and I want to let off some steam. And I really encourage people to get support, even if it's online, whether it be through group therapy, whether it be through online group therapy, even cognitive behavioral therapy. There are a lot of apps where you're not even engaging necessarily with a person, but somebody, you're interacting with an app that's asking you questions about how are you feeling today? What is your mood? What are the triggers? What led you to this? Is there another way to look at this? So much about therapy is about reframing the way that we look, being able to find gratitude, being able to find meaning and pleasure. And I say, don't minimize the micro connections. So that might be with your barista, that might be with the bus driver, that might be with your doorman of your building. So opportunities for connection don't always have to be with the people you live with, and they don't have to be with your best friends. They can be with strangers. And we know that connections with strangers are often far more rewarding than we actually anticipate. So the next time a stranger in a safe environment strikes up a conversation, don't hesitate to smile and say hello.
Yeah, smile back. Dr. Varma, thank you. We appreciate your time tonight. An important topic.
Thanks for watching. Click the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.